Heart disease and stroke remain the leading causes of death in the United States. Every year, hundreds of thousands of Americans lose their lives to cardiovascular disease, and millions more live with the daily impact of high blood pressure, clogged arteries, or the aftermath of a stroke. But here's the truth. Most of these cases are preventable with the right knowledge, lifestyle choices, and medical support. In today's video, we're going to dive deep into what heart disease and stroke really are, why they happen, the biggest risk factors, early warning signs, and most importantly, what you can do to protect yourself and your loved ones. Let's start with the basics. Heart disease is a broad term that includes conditions like coronary artery disease, heart failure, and arrhythmia. Stroke, on the other hand, occurs when blood flow to part of the brain is blocked or when a blood vessel bursts, leading to brain damage within minutes. Together, these conditions are often referred to as cardiovascular disease. According to the CDC, about 1 in every 5 deaths in America is caused by heart disease. That's a staggering number, but it also means that awareness and prevention can save millions of lives. So, what causes heart disease and stroke? The most common underlying issue is atherosclerosis, the buildup of plaque inside arteries. Imagine the arteries in your body like highways carrying blood and oxygen. Over time, poor diet, smoking, high cholesterol, and high blood pressure can cause fatty deposits to build up. This narrows the arteries, making it harder for blood to flow. If the plaque ruptures, it can form a clot, blocking blood flow entirely. In the heart, that leads to a heart attack. In the brain, it causes a stroke. Now let's talk about the major risk factors. Some of them we can't control, like age, genetics, and family history. But most of the biggest contributors are lifestyle-related. High blood pressure, high cholesterol, obesity, smoking, lack of physical activity, diabetes, and even chronic stress all play a massive role. The good news is that addressing these risk factors doesn't just reduce your chances of heart disease. It also improves overall health, energy, and quality of life. One of the most powerful tools you have is diet. The American Heart Association recommends eating more fruits, vegetables, whole grains, lean protein, and healthy fats like those found in nuts, olive oil, and fish. Reducing processed foods, sugar, and excess salt can have an immediate effect on lowering blood pressure and improving heart function. For example, replacing a fast food burger and fries with a grilled chicken salad topped with avocado may seem small, but over time, these choices protect your arteries from damage. Exercise is another game changer. You don't need to run marathons to see results. Just 30 minutes of brisk walking 5 days a week can lower blood pressure, boost circulation, and strengthen the heart muscle. Even everyday activities like gardening, dancing, or biking with your kids count as physical activity. The key is consistency. Smoking, on the other hand, is one of the most dangerous habits for your cardiovascular health. Cigarette smoke damages the lining of your arteries, increases blood clotting, and lowers good cholesterol. Quitting smoking immediately starts to repair your heart and lung health, no matter how long you've smoked. Another silent but deadly risk factor is high blood pressure, often called the silent killer. Many Americans don't even realize they have hypertension because it shows no symptoms until it causes major damage. That's why regular checkups are so important. If you're over 40, make sure to get your blood pressure checked at least once a year, and if you already have risk factors, more often. Let's also talk about warning signs. For a heart attack, the classic symptoms include chest pain or pressure, pain in the left arm, shortness of breath, nausea, and cold sweats. For stroke, remember the acronym F.A.S.T, face drooping, arm weakness, speech difficulty, and time to call 911. Acting quickly can mean the difference between full recovery and permanent disability. Beyond lifestyle changes, modern medicine has given us powerful tools to fight cardiovascular disease. Medications like statins help control cholesterol, while blood pressure drugs lower the strain on arteries. In some cases, procedures like angioplasty or bypass surgery are needed to restore blood flow. But even with these treatments, Prevention through healthy living remains the most effective strategy. Finally, let's touch on mental health. Chronic stress, anxiety, and depression are strongly linked to heart disease and stroke. Stress hormones like cortisol increase blood pressure and inflammation, both of which harm the cardiovascular system. That's why activities like meditation, yoga, and simply unplugging from screens to enjoy nature can be just as important for your heart as diet and exercise. So here's the bottom line. Heart disease and stroke are not inevitable. With knowledge, awareness, and action, you can dramatically reduce your risk. Start by making small but consistent changes. Eat better, move more, quit smoking, manage stress, and see your doctor regularly. Protecting your heart today means a longer, healthier, and more fulfilling life tomorrow. Thank you for watching. If this video was helpful, don't forget to hit like, subscribe, and share it with someone you care about. Together, we can raise awareness and fight back against America's #1 killer, cardiovascular disease.